When caring for an aging loved one, it's important to recognize subtle changes that might indicate they're entering life's final chapter. While many assume the end comes suddenly, the body often provides warning signs months or even a year in advance. Recognizing these indicators early allows families to provide better care, create meaningful memories, and ensure dignity during this transition. These signs aren't meant to alarm but to prepare, allowing families to make informed decisions about care, living arrangements, and end-of-life wishes before crisis moments arise. 5 key warning signs to watch for. 1. Unintentional weight loss. One of the earliest and most telling signs is significant weight loss without trying. You might notice looser clothing, decreased appetite, less interest in formerly enjoyed foods, meals left largely untouched, complaints about food tasting different, difficulty swallowing or chewing. This weight loss often indicates the body is no longer efficiently absorbing nutrients. The digestive system slows down, muscle mass decreases, and the person may struggle to process protein effectively. This leads to increased weakness, vulnerability to infections, and higher fall risk. What begins as a few pounds can quickly accelerate, especially in those already thin or frail. Physiologically, this process represents a fundamental change in metabolism. The digestive enzymes decrease in production, making it harder to break down nutrients. The intestinal lining may become less efficient at absorption. Hormones that regulate hunger, like ghrelin and leptin, undergo changes that dampen appetite signals. For many elderly individuals, this creates a disconnect between bodily needs and hunger sensations. Many elderly individuals experience diminished hunger sensations and changes in taste perception, making food less appealing. The body, sensing its gradual decline, reduces hunger signals. While nutritional supplements and favorite foods may help, forcing large meals isn't always beneficial. Focus instead on comfort, hydration, and easy-to-eat options. Small, nutrient-dense meals offered frequently often work better than 3 large meals. Smoothies, protein-enriched beverages, and soft foods that retain their flavor can help maintain nutrition when traditional eating becomes difficult. Healthcare providers may recommend tests to rule out treatable causes like thyroid disorders, medication side effects, or dental problems. However, when weight loss persists despite interventions, it often signals the body's natural transition toward the end of life. 2. Profound fatigue and weakness. Beyond normal tiredness, this is an overwhelming exhaustion that makes even basic tasks challenging. This deep fatigue doesn't improve with rest and often indicates the body conserving its remaining energy. It differs markedly from ordinary fatigue. It's persistent, pervasive, and progressive. As organ function declines, particularly heart function, circulation weakens and muscles receive less oxygen. The body redirects energy from activities to essential functions, resulting in increased sleep needs, difficulty sustaining formerly routine activities, sudden energy drops, withdrawal from social activities and hobbies, needing assistance with tasks previously managed independently, extended recovery time after minor exertion, spending more time in bed or sitting, decreased motivation for movement. This fatigue stems from multiple physiological changes. Mitochondria, the cellular powerhouses, become less efficient at producing energy. Hormonal changes affect energy regulation. The cardiovascular system delivers less oxygen to tissues. And chronic inflammation, common in aging bodies, diverts energy resources to immune function rather than daily activities. For seniors who valued their independence, this loss of energy can cause frustration and embarrassment. Rather than pushing them to be more active, understanding their limitations and providing support creates a more peaceful experience. Adaptive equipment like walkers, shower chairs, and raised toilet seats can help conserve energy for more meaningful activities. Scheduling important conversations or visits during their typical energy peaks respects their changing capabilities while maintaining connection. The emotional toll of this fatigue shouldn't be underestimated. Many seniors grieve the loss of their former vitality and independence. Acknowledging these feelings while helping them focus on what they can still enjoy provides important emotional support during this transition. 3. Cognitive changes and social withdrawal. Mental changes often precede physical decline. Someone previously sharp might begin forgetting things more frequently, struggling with conversations, becoming disoriented in familiar settings, repeating themselves, losing track of time, mixing up names or relationships, difficulty following plots in books or shows they previously enjoyed, trouble managing finances or medications, showing unusual emotional responses, experiencing personality shifts. These aren't just normal aging signs but result from decreased oxygen to the brain as circulation weakens. The person may experience fluctuating lucidity with episodes of confusion. The brain, requiring approximately 20% of the body's oxygen despite comprising only 2% of body weight, becomes vulnerable to even minor circulatory changes. Neurologically, several processes occur simultaneously. Neurotransmitter production changes, affecting mood and cognition. Some brain regions may receive insufficient blood flow, especially during periods of stress or illness. The blood-brain barrier becomes more permeable, allowing inflammatory compounds to affect brain function. These changes aren't necessarily dementia, but rather the brain responding to the body's overall decline. Emotional withdrawal is equally significant. Many seniors speak less, engage less in conversation, and spend more time in silence. This isn't disinterest, but rather the brain processing emotions and interactions differently. Some become more irritable or anxious, while others become unusually calm or detached. Sensory stimulation may feel overwhelming, causing them to retreat from noisy or chaotic environments. Some individuals in this phase begin discussing deceased loved ones as though they're present, or describe seeing spiritual figures. Rather than dismissing these experiences as confusion, many hospice professionals recognize them as part of the transition process that provides comfort. For families, this stage can be particularly difficult as it feels like losing their loved one before they're physically gone. Meeting them where they are, speaking gently, offering reassurance, and creating a safe environment becomes essential. Using simple sentences, maintaining eye contact, minimizing background noise, and respecting their changing reality helps maintain connection when verbal communication diminishes. 4. Frequent infections and slow healing. A declining immune system means more frequent illnesses and slower recovery times. Increased susceptibility to common infections, colds, flu. Recurring issues like UTIs, pneumonia, and skin infections. Antibiotics becoming less effective. Wounds, cuts, and bruises healing more slowly. Pressure sores developing more easily. Persistent low-grade infections that don't completely resolve. Increased instances of thrush or other fungal infections. Development of edema or fluid retention. The immune system, already compromised by age, undergoes further decline in the final year of life. White blood cell production decreases and existing immune cells function less efficiently. The inflammatory response, crucial for initial healing, may become dysregulated, either insufficient to fight infection or chronically elevated, causing tissue damage. In elderly individuals, infections often present differently. Instead of high fevers, watch for increased fatigue, confusion, or decreased appetite. This blunted response occurs because the aging body produces fewer inflammatory cytokines in response to pathogens. Temperature regulation becomes less precise, sometimes masking fevers that would signal infection in younger people. As circulation declines, oxygen and nutrients don't reach tissues efficiently, compromising the healing process. Skin integrity weakens as collagen production decreases and subcutaneous fat diminishes. Pressure points become more vulnerable to breakdown, especially in less mobile individuals. Proper positioning, specialized mattresses, and regular movement become essential preventive measures. While medical interventions are important, there comes a point when comfort becomes the priority over aggressive treatments. Maintaining hydration, skin care, and minimizing stress on the body often provide more benefit. Discussions with healthcare providers about the goals of care become increasingly important, determining when treatments help maintain comfort versus when they prolong suffering. 5. Changes in breathing and circulation. Altered breathing patterns and circulation issues are significant indicators of the body's preparation for its final stage. Slower or shallower breathing. Pauses between breaths. Irregular breathing patterns, alternating between rapid and slow. Coldness in extremities, hands, feet, ears, nose. Pale, bluish, or mottled skin, especially in the fingers and toes. Increased shortness of breath with minimal exertion. Difficulty breathing when lying flat. Development of peripheral edema. Increased daytime drowsiness. Changes in blood pressure, typically lowering. Weaker or irregular pulse. These changes occur as the body prioritizes blood flow to vital organs, reducing circulation to extremities. The heart isn't pumping as strongly, and lung function may be declining. Some individuals develop fluid in the lungs, causing coughing, gurgling sounds, or chest tightness. The respiratory center in the brain may become less responsive to carbon dioxide levels, altering the breathing drive. Physiologically, the cardiovascular system undergoes significant changes in the final year. Heart muscle weakens, valves may function less efficiently, and blood vessels lose elasticity. The autonomic nervous system, which regulates involuntary functions like breathing and circulation, becomes less coordinated. These changes aren't necessarily painful but represent the body's natural preparation for shutting down. For caregivers, these symptoms can be alarming, but they're often part of the natural slowing down process. Creating a comfortable environment, keeping rooms cool, using humidifiers, offering small sips of water, can provide relief when medical interventions may not reverse the underlying changes. Proper positioning with the head elevated often eases breathing difficulties. Gentle massage of cold extremities provides comfort and maintains circulation, even when warming them completely isn't possible. Medical professionals may offer oxygen therapy, moisture-enhancing mouth care, or medications to reduce fluid buildup or anxiety about breathing changes. These interventions focus on comfort rather than extending life, recognizing the natural progression taking place. Recognizing these signs isn't about fearing death but preparing for it compassionately. Instead of fighting against these natural changes, focus on making your loved ones' remaining time peaceful and meaningful. This knowledge allows families to offer better care, make important decisions proactively, and ensure dignity during this transition. The final year represents an opportunity for completing emotional business, expressing love, resolving conflicts, sharing important memories, and ensuring the person knows the impact they've had on others' lives. It's a time for attending to spiritual needs, whether through formal religious practices or personal meaning-making. Documentation of preferences, updating advance directives, and practical preparations reduce stress during the final weeks and days. Understanding this journey helps you find strength and patience during a challenging time. Remember that many others have walked this path before you, and while never easy, knowing what to expect can bring some peace to the process. Reaching out to hospice services, support groups, and counselors provides additional resources for both the elderly person and their caregivers during this significant life transition.